Hello, everybody. My name is Edwin Mugu, a DMP student at UMass Global, and I welcome you to my pharmacology case presentation. I have chosen Tegretol as the medication for my case study. Tegretol, with the generic name carbamazepine, is an anticonvulsant and an anti-epileptic drug. Tegretol is a brand name for this medication class, and other brand names include Gabatril and Epitol and so on. It works by blocking voltage-gated sodium channels in neurons. These channels play a crucial role in generating and propagating action potentials, which are electrical impulses that allow neurons to communicate with each other. Tegretol is used to treat and control seizures, used to treat chronic neuropathic pain and nerve pains such as diabetic neuropathy. Tegretol is prescribed in the treatment of tonic-clonic seizures, also known as grand mal seizures. Also, Tegretol is prescribed in the treatment of trigeminal neuralgia, which is a type of seizure facial pain that occurs due to irritation or damage to the trigeminal nerve. In some cases, Tegretol is prescribed to allow neuropathic pain, which is the pain caused by damage or dysfunction of the nervous system. This can include conditions like diabetic neuropathy, post-hepatic neuralgia, pain following shingles, and other neuropathic pain syndromes. Tegretol offers some benefits, which include its effectiveness in seizure control in epilepsy patients. Tegretol is also effective in treating trigeminal neuralgia. Tegretol contributes to a more balanced and manageable emotional state for individuals with bipolar disorder. Finally, Tegretol is effective in relieving neuropathic pain. The risks involved in the use of Tegretol may include skin rashes that may lead to death, serious blood problems, including but not limited to bleeding gums or nosebleeds. The use of Tegretol may cause serious allergic reactions. Using Tegretol may also cause suicidal thoughts and ideations. Some of the contraindications in the use of Tegretol include pregnancy, where the use is harmful to the fetus. Also, during lactation, using Tegretol can seep into the milk and in turn becomes harmful to the child. My first case study is use Tegretol involves Sarah, who works as a teacher. She she lives an active lifestyle and enjoys hiking. She lives with her partner with two children, both 4 and above, and has a supportive social network. She is my army veteran. She is an army veteran. Sarah has a history of partial onset seizures. She has been experiencing these seizures for the past 2 years, with episodes occurring approximately once every month. Sarah is a 30-year-old Asian woman. The records we are gotten from the patient records. Her chief complaint is that she's experiencing seizures more frequently. She presents deals with consistent seizures, which are intense. She currently uses a levetiracetam 500 milligram. Sarah has no Sarah has no plans to get pregnant anytime soon. She diagnosed She's diagnosed with seizures 2 years ago, occurring at least 3 times a week. Sarah is morbidly obese and currently complains of itchy fingers and feet. She has no known allergies. Her father also served in the army and was treated for major depressive disorder until he died. Sarah holds a bachelor's degree. Her mental status exam shows that she shows severe PTSD symptoms. Sarah is very open and honest about her history, although she avoided questions about her service records. There were no acute findings. The differential diagnosis shows seizure and post-traumatic stress disorder. Sarah was prescribed Tegretol 200 milligram at an initial dose, gradually titrating upward based on her response and tolerance. Baseline EEG, imaging studies, CBC, liver function test, and RFTS were conducted. Patient weights were monitored. Hemoglobin A1C was 8.4, Tegretol 200 milligrams 2 times a day. Family support, constant seizure monitoring. The patient was educated to attend all scheduled lab draws. Referrals. Referrals were made to the patient PCP to monitor the patient for diabetes. Sarah has a 2-year history of seizure. Previous use of an anticonvulsant has been ineffective. Patient patient isn't looking to get pregnant anytime soon, hence the risk of an adverse effect are minimal. Tegretol is an appropriate choice for treatment. Tegretol symptoms. My my second case study My second case study to not use Tegretol involves TJ. Is a retired individual living alone. He lives a relatively sedentary lifestyle due to his heart condition, but remains socially active within his community. TJ has a history of heart disease. He also has a documented allergy to carbamazepine with previous episodes of severe skin rash and drug-induced hypersensitivity reaction. TJ is a 65-year-old Caucasian man. The records were gotten from her patient record. His chief complaint is that he has skin irritation and rashes due to the drug-induced hypersensitivity reaction. He presently deals with consistent seizures intense, which are intense. He currently uses Tegretol 400 milligrams. EJ has a history of treating anxiety and depression. TJ has heart conditions, coronary artery disease, and hypertension. Allergic to carbamazepine. TJ released no family history. TJ had TJ had a 35-year-old work experience with the federal government. ECL 5 score of 40, who shows moderate PTSD symptoms. TJ was prescribed with trial levetiracetam 500 milligrams twice a day for 2 weeks. If changes aren't noticed, tit- titrate with viproc acid. Diagnostic lab work, baseline EEG, imaging study, CBC, liver function tests are RFTs. Monitor weight, blood pressure greater than 130 over 90. TJ has a long history of anxiety and seizures. Previous use of an anticonvulsant have been effective, but adverse reactions occurred. Patient isn't looking to get pregnant anytime soon, hence the risk of an adverse effect are minimal. Tegretol is an appropriate choice for treatment. Target symptoms. Lesson learned. The best medication is not always the most appropriate for patients. Understanding patient family histories could lead to a better pharmacological recommendation from healthcare practitioners. Cultural factors are important in making choices for pharmacotherapy options. Thank you, and here are my references. And thank you again.